Hello everyone, this is Shomujit Mukherjee. You all are welcome to my channel Shomujit Mukherjee. This is not only my channel, this is your channel as well. First of all, I would like to thank each and every one of you for your constant love and affection that you showered on me, especially to my two previous podcasts. Yes, I am back again with my third podcast. This time, my guest is someone who is from a different field. You all know that I always welcome guests from a different fields and from different section of the society. This time, he is from the medical field. You guys guessed it right. He is a doctor. He was the principal from Calcutta National Medical College, and he was also the principal of KFC Medical College. Without wasting any more time, I would like to welcome Dr. Siddhartha Chakraborty. He is a renowned cardiac surgeon, a mentor, an academician, and a Rotarian. So, let's welcome the guest of tonight, Dr. Siddhartha Chakraborty. From heart count to health, and now to the health of the heart. Let's welcome the guest of the evening, Dr. Siddhartha Chakraborty. Sir, how are you?
Thank you very much.
So I hope
Yeah.
you're doing well.
Fine, absolutely fine.
So, sir, my first question of the evening. You have spent most of your professional life at National Medical College,
No, at Calcutta Medical.
Calcutta Medical College. What was that legacy mean to you?
Well, established in 1835, our Medical College Calcutta happens to be the first medical college in Asia. You know, what a legacy. I was fortunate enough to be selected in that medical college, that hallowed ground, and was taught by very senior and, those teachers. I'm very fortunate indeed. And after my study, fortunately, I happened to work in the cardiothoracic surgery department of this medical college for a pretty long time, from 1980 onwards.
Okay.
Okay. And I was there for a pretty long time, last 7 years as the head of department. Then I was given the charge of entire hospital as the medical super cum vice principal.
Okay.
And then they pushed me out, made me a principal of another medical college. I had to leave my alma mater as a fag end. Yeah.
After that, where you joined?
After that, I joined Calcutta National Medical College. I retired from there and then joined KPC Medical College, Jadavpur. Was the principal over there too. And I have retired after attaining the age of 70. You know, after 70 years, you can't be a medical teacher as per NMC rules.
Okay.
Okay. I am now retired.
Okay. Happily retired, sir.
Happily retired. Happily.
Sir, you have worn many hats in your life, in your professional life, from administrator to surgeon to teacher. Which role has brought you more fulfillment in your professional life?
No question. It was as a teacher. No question asked. You know, when you are a teacher, you deal with young minds, and that makes you green. And being a teacher, especially when guiding the postgraduates and the postdoctorates as well, you have to keep abreast of what's happening everywhere. You have to upgrade yourself. You have to know the latest in your field.
Whether it's
Yeah.
technology.
Yes, definitely. You have to know. Otherwise, how can you teach?
True.
Yeah. And, another aspect. The dream of any parent is to see his or her child to grow in life, to be well established.
Absolutely.
So this happens with all the teachers. I am very happy. Today, there are 4 centers in West Bengal, in teaching institutes, which run cardiothoracic surgery departments.
Okay.
Of all the 4, the 3 are headed by my students.
Oh, that's great, sir.
Similarly, in the private sector, one of my students, he is a nationally known a thoracic surgeon who is now in robotics too.
Oh,
And in private sector, 3 of my students are heading the corporate sector in three different institutes, not colleges, institutes, both in West Bengal and outside. Yeah, I'm in seventh heaven. বাংলায় যাকে বলে না স্বর্গ সুখ.
Rightly said. Sir, my next question to you. How have heart diseases changed over the last 40-50 years in terms of demographics and patterns?
Well, permit me to deviate a little bit. Let us look at the thoracic problems, the chest, the lungs. 40 or 50 years ago, gross majority of the patients, they were affected with complications of tuberculosis and infectious disease. Now, gradually, they are a bit minority now. Presently, the majority of patients are suffering from ischemic heart disease, coronary artery disease, that require open heart surgery, the bypass surgery, or stenting maybe. And in extreme cases of heart failure, we have to go for heart transplant.
Okay.
The pattern has changed.
So the pattern has changed over the years.
Yeah, definitely.
Okay. Sir, a very important question. What about children? If we look at this particular infant section of these children, the heart disease is on the rise. Or are we simply diagnosing them?
Well, that's a very difficult question. You know, on the one hand, the diagnosis has become much easier. Now, the parents are more careful about their valued children. Whenever there is some problem, they rush to the pediatricians, and there are many. And with modern modalities, we can diagnose them very early. This is one aspect. The other is, previously, many ladies, especially in the rural side, rural Bengal, they used to go to quacks with minor ailments during pregnancy. The quacks prescribe some drugs which affect the growth of a heart.
Okay.
And so, unfortunately, there were many patients with heart defects. But now, with good antenatal care available throughout the West Bengal, that number has decreased. So, as a whole, I don't know whether the figure has increased or not, but it was there, it is there, it will be there.
Okay. Is the same thing is persisting in the urban areas as well?
More or less.
More or less.
More or less. Fortunately, in urban section, the effect of quacks was much less.
Much less.
Much less.
So what can be the remedy according to you?
There is no remedy, you know. You have to prevent. Well, it is one of the causes of congenital heart diseases. This bad administration of drugs. There are so many other causes. So, maternal diseases during pregnancy. Some diseases might occur in the ladies. This might cause congenital defects. And there are some genetic abnormalities.
Genetical abnormalities are also the reason.
You know, I'll tell you one small thing. I think King Charles II, he was a blue baby.
Of England.
Of England, yeah. He was a blue baby. He had a congenital cyanotic heart disease.
Okay.
Okay, and that's why blue-blooded has been regarded as a taste of royalty.
Okay.
But there, what about, and today also, the blue babies or the baby who becomes blue on crying is taken to the pediatrician immediately. But what about the babies who are not blue, but who suffer from failure to thrive? What about them? We don't know what was the picture before. Now they are being diagnosed and treated.
Okay, sir. Okay. Sir, you have worked very closely with the biomedical teams for sure. So, what are the changes you have noticed over the 30 years, especially in terms of related to cardiac surgery and all?
Well, allow me to debate again that lung. For lung disease, at that time, say 40 or 50 years ago, we had to rely on our clinical examination and X-ray. And there was an investigation, bronchogram. We had to inject a dye inside the trachea so that the entire lung field is filled with that drug, and then position the patient in different postures so that the dye goes throughout the lung, and then take X-ray. Then came CT scan, and that fine art has gone to oblivion. Similarly, in cardiac surgery, we had X-ray, we had ECG, apart from our clinical examination. And for congenital heart diseases, we had to introduce a catheter, a fine tube inside the heart, take blood samples, and measure the oxygen content to calculate the shunt, where the shunt is occurring and how much. And we had to take the pressure within the different chambers of the heart. Yeah, that was an invasive procedure. Once echocardiography arrived, gradually it has become very common. Nowadays, in every mahalla, you will find one echocardiography center.
Yes.
Yeah, fine. Similarly, there are so many examples, the transesophageal echo. When I telling about echo, transesophageal echo, and echocardiography done through esophagus, through the foot pipe. That is very useful during the operation, perioperative transesophageal echocardiography, especially in surgery for congenital defects and for repair of valves. That's very helpful. And there are so many, your intra-aortic balloon pump or automated defibrillator. They have rescued many patients after surgery. Regarding monitor, we had to rely on monitors showing us the ECG and pressure waves. Now they gave you the the cardiac output and all this data real time.
Okay.
This has revolutionized. Yeah, cardiac surgery has become changed. Say, our routine exposure was through splitting the sternum, the breastbone.
Yes,
we
yes.
had to split it and then go inside and do the job. Now, with advances in technology and materials, we can go through a small incision in the chest, by the side of the chest, and do the surgery. Less problem to the patient, less hospital stay, less complications. Marvelous.
Okay.
It is changing a lot.
That's a revolution of medical science.
Sure.
Sir, my next question, which is very important. What role does stress, lifestyle, and urbanization play in today's cardiac health crisis?
Well, that's rather a chapter, not a simple paragraph. Number one is stress. Stress is a very bad word. During a stress, there is liberation of some hormones. One of them is adrenaline. When we are stressed, there is secretion of adrenaline, the fight or flight hormone. What does it do? There is a increase in heart rate, increase in blood pressure. The heart has to work overdrive, and it is very bad thing. And this is known as, you may call it a temporary phenomena. And when it goes on, as is usually in stresses, the liberation of other hormones too. And so what happens? The artery the coronary artery and other arteries, their walls get deranged. There is an increased chance of atherosclerosis deposition. With hypertension and blood sugar also, there's high blood sugar. So with hypertension and diabetes, there is every chance of ischemic heart disease. Another thing happens in the atherosclerotic plaque. When there is sudden hypertension, sudden high pressure, the plaque ruptures and a small fragment floats downwards, blocking a coronary artery, causing immediate blockage of the artery. We call it myocardial infarction or heart attack.
Okay.
So stress is very bad for the health of heart. The reverse are the good hormones like dopamine, serotonin, etc. They are liberated when you are in a peaceful mind. When you are doing something which you like, they are automatically secreted, and that is good for heart. They reduce the blood pressure, they reduce the heart rate. That settles the heart. This is the number one point, that's the stress. Next point, you were asking about urbanization.
Urbanization, yes.
Yeah, that's really a problem. With urbanization, there is change in our nutritional avenue. Our food habit gets changed. Instead of those carbohydrate, complex carbohydrate like rice or atta, and fibers, we shift to some sweets which are mainly sugar, which get absorbed rapidly, causing spikes in blood sugar. We take plenty of fast food, that's also bad. There is an increase of smoking, another effect of stress, I must say, increased smoking and consumption of alcohol. Something very peculiar, in rural area, smoking is not that harmful. But in urban sections, smoking appears to be very much harmful.
Why?
One of the reasons might be the effect of pollution.
Pollution, yes.
Effect of pollution. In urban setting, the pollutants, they also enter into the lung through the windpipe. When the size is 2.5 micron, they get absorbed and settles in the lining of the lung. And the lung, it initiates a chronic inflammation. They settle in the lung, causes chronic inflammation, that causes atherosclerosis. So, this smoke, that just augments the process.
Sir, we used to hear that heart attacks or cardiac arrest is a middle age is an old age complication, but in today's society or in today's world, we used to hear that people in their mid 20s or in 30s are suffering from cardiac arrest or heart attacks. Why this is happening?
This is a very sad state of affairs. Genetically, we Indians are rather prone to heart attack more than the Europeans, and at an earlier age.
Why is it so?
Genetically.
Genetically.
Yeah. There had been many studies. It's basically a genetical problem. In Western countries, the median age of heart attack is around about 63 years. In India, it is 53, median age. Okay. And, the patients who die of heart attack, 50% of them in India are below the age of 50. 25% are below the age of 40. Why? One of the main causes is stress. Because of the stress, everything goes topsy and turvy. There is a bad selection of food. There is smoking, there is a consumption of alcohol, too much consumption of alcohol, And there is liberation of adrenaline and other hormones. So, this is one of the main factors. Another thing is, we think we are heart conscious. We go to gym, perhaps once or twice a week. But it doesn't matter really. What matters is what you do in the other days. We are mainly doing desk job. We are in the table, we are doing desk jobs, whatever be the profession. And this causes deposition of your triglyceride, the adipose tissue, causing the punch,
Okay.
causing hypertension, causing diabetes. All are prone to develop ischemic heart disease. So, whoever is in sedentary habit in doing this job, he should try to do 1 minute walking of every hour. 1 hour walking, 1 hour walking, 1 minute walking.
Okay.
Every hour, 1 minute walking. That will be very beneficial.
This is a very vital point that he mentioned. Next question to you, which is a very important one. I'm sure the new generation would like to hear this. If you were to advise young professional who barely have time to exercise or sleep, what three habits would you suggest to protect their hearts?
Number one, change your lifestyle. Change your lifestyle and change your lifestyle. And this is number one. And number two, you reduce your tension. You have to reduce your tension. Do whatever you like. Maybe music, maybe travel, maybe reading, whatever you like. Spend some time for it.
Yeah,
And
that's very important.
enjoy life.
Okay, so enjoying your life at the end of the day is very important. So, youngsters, please listen to this wonderful point that Sir mentioned. Another very important question that I always wanted to know: what goes through a surgeon's mind just before operating on someone's heart?
Well, we do our job. Whenever you go for your job, you start your day, the feeling, it is the same. It is our job, we do our job. It doesn't matter whether it is the heart or it's the lung or it's the kidney.
So, another important question that I would like to ask you: how do you deal with the emotional stress of high stakes surgeries and unexpected outcomes?
Well, for high-tech surgeries, in my OT, there was a music system with light music going on.
Music system?
Yeah.
Oh, that's interesting.
A light music was constantly there, and it soothes you. And about unexpected outcomes, yes, we had to face. We try our level best to save a life, but unfortunately, there are times when we fail. It hurts. Believe me, there were many sleepless nights. I couldn't sleep. Next day, I had another surgery, but it hurts.
It hurts a lot.
It hurts a lot.
Sir, do you have any memories of the patient that you have operated in the past successfully and they have come back to you maybe after 10 years, 20 years to thank you?
The happy moments,
Yes.
real happy moments. Well, about 10 days ago, I had been to a medical conference. There, one of the professor of medicine, young professor of medicine, he came to me and said, "Sir, you don't know me, but I know you. When I was in the first year in 1996, he operated on valve of my mother. and she's absolutely fine now.
Okay.
আর পায়ের ধুলো নিল, একে আমি কি বলবো? This was something.
It feels good actually.
About 1 year ago, a lady came to me with a small kid and her mother. Yes, what's the problem? There is no problem, sir. I was a kid of 3 years age and had a complex congenital heart defect. You operated on me in 2000.
Oh.
And today I am here with my son. I have come just to meet you. Thank you, sir.
Oh, that's a great feeling for you as a doctor.
That's a great feeling. To any clinician, that's a great feeling.
Truly. Sir, my next question. You have been associated with organ donations awareness through Ganadarpan. How important is it to break the stigma around heart transplant in India?
Well, heart transplant in India actually started at AMS in 1964. And gradually it has increased. Today, there are about 200 heart transplants in India annually. Unfortunately, in West Bengal, we are lagging behind. Our yearly output is around 6 to 9 per year over last few years. We have many miles to go. Ganadarpan is working on this, and body donation is much more common here than for caloric donation is over here, than consent for organ donation. You know, only brain dead patient can give the heart, and here comes the role of relatives, legal guardians of the patient. We have to make them sensitize. There's a great task.
Yeah, it's a great task. Sir, we know that you were a Rotarian. You was also the past president of Rotary Club of Behala. Why you choose to become a Rotarian?
Only because of its motto, service above self. And that's it.
That's great. And finally, sir, what does healthy heart means to you beyond biology and surgery?
Healthy heart is the heart full of empathy. And that's all.
Sir, we know that you are an extremely busy person. Thanks to you for your generous time that you have, from your very valuable time you have take out time for this particular podcast and answer all the questions that we asked you, all the valuable answer. It's not only for us, I'm sure for all the viewers of ours, they are also very knowledgeable now. So thanks to you, Dr. Siddhartha Chakraborty.
Thank you. Thank you. Thank you.
So that's all, Dr. Siddhartha Chakraborty, for you. Hope you all like the podcast. He answered some valuable question. I'm sure, like me, you all are now very much experienced about heart and how to take good care of your heart. So, but don't forget to like and subscribe my channel, Shomujit Mukherjee. This is not only my channel, as I always say, that's our channel. And the man behind the camera, the editor, it's a teamwork. It's not only my work, it's a teamwork. So hopefully you all like the episode and wait for our next podcast to come. Thank you. Till then, take care. Dear friends, before I completely wrap up this session, just few words I just want to share with you, that this is not the end of this episode. Dr. Siddhartha Chakraborty will be back on the episode number 2. Is going to be the continuity of this episode. He will be back very soon. So till then, log on to this channel, keep yourself updated. We will be back again with Dr. Siddhartha Chakraborty. Till then, take good care of yourself, take good care of your heart, lead a very healthy life. I'm Shomujit Mukherjee from the YouTube channel Shomujit Mukherjee, signing off.